nitty gritty there. Okay, we got one person still in there in the waiting room. But he's been let in. Okay, there he is. Okay, hi everybody. Thanks for joining us for one of the most favorite events of the new student orientation, and that is when we bring back our alums to show you that actually you will graduate and you will get good jobs or go on to further schooling. And it's not like we just chose these five and we use them all again and again and again. We have several thousand MPH students, and we're proud of all of them. But when we get to hear about what they are doing, it really brings it home to what the college is doing for the world. And so without further ado, what I'm going to do, I hope you all, I sent you all bios of our alums, and I'm going to let them introduce themselves, and then we're going to let you ask questions, okay? Now, while you're listening, one of the things that we really feel is important, if it's possible at all, is if you show your face, so that we get to know you, so that we start to recognize people. So if you could do that, that would be great. Okay, so Rachel Murray has put her hand up to introduce herself first. So take it away, Rachel.
Sure. Thanks, Chris. And thank you all for allowing me to be here this evening. I'm excited to meet you virtually, and congratulations on getting into the program and the start of your MPH career. I graduated from MESCOP with my MPH in 2013. I studied family and child health, the global health track, and after graduating, I started a fellowship program at CDC. It was an ASPPH fellowship program. I did that for about 8 or 9 months and then transitioned into a full-time role at CDC, and that's where I've been since. I work in the Division of Global HIV and TB here in Atlanta, Georgia, where the headquarters is. But Chris, I actually got a new job from the time I sent you my bio to right now.
Oh my
gosh. I'm still at the CDC, but I'll be stationed overseas in our Mozambique office. So,
in your what office?
In Mozambique. So, yeah, so excited to be here and excited to hear from all of you. I'll pass it to the next panelist.
Thank you. Okay, I'm going to go next to you in my screen. It's Marcus.
Gosh, it's hard to follow up a career that's bridging into Mozambique. That's pretty incredible. Congrats. Hi, everyone. I'm Marcus Johnson. It is nice to see and or meet all of you. I'm still here in Phoenix, Arizona. I graduated in 2013 from the Phoenix campus with a concentration in public health practice. I actually wrote my MPH application letter talking about how I would never ever go into something like health or healthcare policy because it was far too paternalistic and it was telling everybody and forcing everybody what to do. And then my first job out of graduate school was as a health policy analyst. And now I'm a health policy director. So you learn, you adapt, you grow, you figure out what your passions really are through the program, I think. I started my career in public health thinking that I just wanted to do things like exercise physiology and help people on a one-on-one basis. And I started a wellness studio with some friends in Tucson. And then I got turned on to public health from a more global sense of health. And after I graduated, I was working at the local health department in Maricopa County, helped to start up their health policy office there. I then became really passionate about the Affordable Care Act and the connection between public health and healthcare. And so I actually moved over to the State Hospital Association for a few years and worked with them to try to develop a more community health mindset within the medical system. And then I had an opportunity 4 years ago to move over to a health foundation here in Arizona called Vitalist Health Foundation, where I'm the health policy director. So I help to oversee the foundation's health policy agenda. And I also still work a lot in the field of access to care and trying to build a more community-based healthcare system. And so, yeah, I think I'll stop there, and I look forward to talking more later.
Thanks, Marcus. Alex, you're next.
All right, well, thanks. My name's Alex. I'm actually from Tucson, and I got a bachelor's there. And I graduated from the MPH program in the policy and management track in 2014. Yeah. I did my internship project in South Sudan with a nonprofit that I had worked with before in the same place. And so after the MPH program, I went back for about 6 months and took a logistics contract with them. And then what did I do after that? Oh yeah, I came back to Tucson. I worked at Banner UMC, or at the time it was UAMC. Now it's Banner UMC. I was like an analyst in the transplant department, mainly like data stuff, looking up numbers and emailing them to people. And then after doing that for just under a year, I moved over to the U of A Peterson HIV clinic. And there's actually quite a few like MESCOV graduates that work there, or have worked there as well. Great environment. Working with patients was really awesome. And through that, I realized I wanted to do clinical care myself. So I decided to do more school, decided to become a nurse practitioner. I started a 3-year program in Portland, and I actually just finished it in June. And I just had 2 job interviews today, and so I am actively unemployed. So,
How does that look, though?
what do you
How
mean?
does the job market look?
Oh, it's pretty thin. There's a lot of like experienced healthcare providers that don't have jobs, and so I'm kind of just waiting. So, but I mean, the program, I got my RN and then went straight into the nurse practitioner route. Yeah, so I'm up here in Seattle now.
That's great.
Yeah.
Miss Ana Ortiz.
Hi, everyone, and thank you for having me. I graduated from MESCOV in 2017. I did my internship with a nonprofit in Nicaragua focused on doing a survey of user satisfaction with water quality in rural communities. And that really impacted my path afterwards. So once I graduated in 2017, I got a short consultant position at PAHO, the Pan American Health Organization in DC. I was only there 6 months, but I feel like that's all I needed to get like a lifetime of education from them. To me, the PAHO, the WHO, was like the mothership, you know. And I did it, and I'm glad I did it, and I don't have to do it again. Learned my lessons, and was glad to come home as well with that experience under my belt. And once I came back, I landed back at an organization that I had worked at before applying to my master's. It's a nonprofit based here in Phoenix called Esperanza, the global health organization. And I am now the international program director. So I oversee our strategic partnerships with nonprofits in Bolivia, Peru, Nicaragua, Ecuador, and Mozambique. Hey, hey. And so I've been doing that since 2018. And yeah, I mean, I was a global health track, so that's kind of where my mind was set from the get-go. And I feel really lucky to have found a place here at home, Phoenix, where I could find a way to impact the world and still live at home without having to be a globetrotter full-time. So yeah, that's a little bit about me.
Thank you. And last but not least at all is Lindsay Walker.
Thanks, Chris. Congratulations, everybody. So I am a 2014 MESCOF graduate, and I really hadn't heard of public health until I was in the Peace Corps, and I was in Peace Corps Ecuador for 2 years from 2009 to 11, and I realized that was the career field that I wanted to go into. I still didn't know exactly what I wanted to do, but I knew that was the main draw. And so I was able to participate in the public health master's program through the Peace Corps Fellows program. And so that opened up a lot of opportunities. I met Rachel there. And so I ended up doing my internship in locally in Arizona. I'm from Arizona, and I'm actually back in Arizona. And so I ended up doing my internship with a youth outdoor adventure program, and I did a photo voice program and qualitative internship. So I kind of have an unconventional public health career path compared to what I'm hearing. I'm so impressed. Like, everybody's done amazing things. And so mine's been a little bit different. I graduated and stayed in Tucson for a year and worked with a nonprofit called El Grupo Cycling. You'll probably, if you're new to Tucson, you'll probably see the youth riding their bikes around with their jerseys. And I was the director there. And then I moved to Oregon and worked and managed a youth development program. I really saw it, I think everything's related to public health. And so I saw it as an opportunity to help youth build skills and to improve their social determinants and to get good jobs. And so then I worked there for about 4 years, and I just moved back to Phoenix. I worked with the Department of Ed as a suicide prevention training specialist on a SAMHSA grant. And then I just on Monday started a new job at Glendale Community College as a career service internship coordinator.
Wow, thank you. One of the things that they're making me think of is like how fast the job situations change, and how late it is for Chris Tisch to know where they are. So the challenge to all the new students and to our alums is, if you guys please make yourselves a LinkedIn account and keep it up, so that when we want to talk to you or want you to come back for one of these deals, we know where you are, or we say, hey, Katie Herder, we know what she's doing, and she would be perfect for this job, and then we can find you. Okay, so it's not about, I'm not the person that sticks my hand out for money. Okay, so just know that. Have I ever done that, you guys? No, I've never asked you for money. So we did ask if anybody had questions that they wanted to ask, and I did have. I've already lost it again. I think is it Kelly Johnson or Riley Johnson who had the questions? Does anybody know?
Hi, yeah, it was Riley Johnson. Hi, yeah. I can ask the question to the whole group. So it's a bit of a mouthful. Let me get it up. I did type it up. If you could pinpoint one or a few decisions you made either during your degree program or post-graduation that most positively impacted the course of your career, what would it be? Was it an internship experience, learning a skill, making a network connection, or something else?
Who wants to? Important decision. They're thinking.
I can
Go for
start
it.
us off. To me, when I first started the program, I moved from Phoenix to Tucson with the intention of, this is such a big investment, right? Economically, time-wise, effort, and to me, I was like, if I'm going to do this, I'm going to do it right, and I'm going to get as much out of this as possible. I'm going to get my money's worth. So that was my mentality. So when I got there, you can ask Chris, you can ask Tanya, I was involved. I got into all the things and I showed up and the meetings and everything. And I know that's not possible for everyone. I was like a little bit overextended my first year for sure. But I took a lot out of it. I definitely absorbed a lot from the staff and the professors. So I would encourage you guys to get involved in, maybe not in everything, but find your niche, find that one club, that one area, that one research project, whatever it is that you really want to sink your teeth into. Because I took a lot from either SJS or the ambassadors program. Even being a TA, you kind of get like a behind the scenes look at working with the different professors. So I would say that really made a difference for me.
Anna, you want to talk a little bit about what SJS is?
Yeah, the Social Justice Symposium. It's a student-run conference event once a year. The entire committee is students, and it's kind of guided by a couple of staff members, but it's all the fundraising, all the marketing. So you really learn how to pull off a conference event. I had never done it before. I didn't have experience in it, and that's why, you know, there's a couple staff on the committee that help you help guide you along the way, make sure that the event still goes on. But it really was a great experience in working together and finding, you know, the right speakers for whatever the topic was for that year. And it was really awesome because it gave us an opportunity to build some leadership while building some really strong connections in the community and outside of the Tucson community as well. I'd encourage you guys to look into it. It was really a fulfilling experience for me.
That conference has been going on, I think, for 13 years, or this will be the 14th, or Gisela, am I wrong there?
This will be the 15th.
Ooh, the 15th, okay. And it's really a great conference to get involved in, because you get to choose the theme of it and you get to mold it the way you want it to be. And I will tell you that this year we had everything all ready to go for our conference, and guess what happened? COVID happened, so we had to do it all online. And we learned all about Zoom bombing that night, and one of those nights, we did all kinds of fast training to, you know, and we learned more about Zoom that night probably than we ever have since then. But anyway, it's a great activity to get involved in, and we really thank anybody who is involved in that committee, because it builds your leadership and it makes the college look great, etc. Okay, does anybody else can pinpoint the great decisions that you made while you were here?
The first thing that comes to my mind, I don't know if it's a decision point or more of kind of a mindset that I decided to place myself into. So my undergrad was in it was in physiology and biology. And so I kind of came into my public health program with a mindset that there were going to be solutions to every single problem that was presented in front of me. Because that's what like medicine is like. It's like, okay, this is the ailment, here's the solution. And I quickly learned, I think it was one of my first days in public health school, and we were discussing like, how do you properly design the placement of a highway to minimize displacement within certain communities? I was like, I don't frickin' know. Is there an actual solution to this problem? And it forced me to really start realizing that a lot of the public health problems we have to address require a critical thinking mindset, and that it's never going to be right or wrong, but it's in most cases there's going to be answers that are better and some answers that just make the problem worse. And so it kind of forced me to think about, how do I reframe my mindset to improving certain public health problems versus fixing everything right away. And my dad is an engineer, so every time I try to discuss with him that, yeah, we're incrementally moving forward, he's like, no, you need to find your problem and find your solution. And I'm like, that's not necessarily how all public health works. So I think that kind of change in mindset is the one decision point that that resonates with me.
Did you, it sounds like you felt that way from the very beginning of the coursework.
I did. And I kind of learned to really love thinking critically about these long-standing intractable issues, whether it's obesity or difficulties with getting populations toward herd immunity for vaccines, all sorts of big picture public health issues. If there was an easy solution, it would have been done a long time ago. And so you have to just kind of realize that a lot of the problems that we're trying to address, there's no simple solution. And I think that the most exciting part about that is that it forces multiple people to come together to think critically about things. And it's not something where Marcus is going to go into his office for 2 hours and he's going to come out with some brilliant paper that's going to solve problems. So I've always said public health is a team sport.
On that note, though, you're right up against the notion that there are a lot of group projects and group work in the curriculum. So how did you guys, what advice would you have for these folks about how to handle those assignments?
I'll go. I was in a group with Tanya and Lindsay for at least one class, maybe multiple. I don't know. It was a long time ago. I would say, get to like your classmates. One of the coolest parts of the program was like just all the people that were in it with me. It's cool being able to have conversations about public health with other people that are as nerdy about public health as you are. So that was kind of a novelty. It was really cool. And like the group that we had, Tanya and Lindsay are just amazing. So like the groups are a lot easier if you can just like keep an open mind and get to become friends with the people you work with.
I think to add on to that, I definitely remember a lot of group work. And I would definitely encourage you, if you have the option of, picking people for your group, to maybe try to reach out to people that might have very different backgrounds, experiences, and perspectives from you. I've definitely learned throughout my time post grad school that that's kind of where you have the best quality work, is when you're able to work with people that can bring different skills and different mindsets to a project. So definitely encourage you in your group work to also be able to try to do that. It will help you in your career.
Betsy, it looks like you've got your hand up.
Yeah, hi everyone. I'm Betsy Sorensen. Just want to shout out that I was a RPCV in Guinea, so congrats to all my fellow Peace Corps volunteers. I had a question regarding, right now, I find myself really interested in a ton of different public health topics, and I know that my concentration is just maternal child health, but there is a decent amount of flexibility with the elective classes that we can take. So I'm just curious how you guys focused yourselves, or did you find it was almost better to kind of get all your feelers out, take a bunch of different classes to really focus in on what you were interested in? I guess if you just had any advice or anything about that. Thanks.
I might be able to answer this one for you, Betsy, because I don't know if I mentioned I did health behavior and health promotion. And so that, as far as the career field, it's vast. So it's wonderful because you have a lot of options for careers, but you also really have to sell yourself as a public health candidate. It's not as specific as an epidemiologist or environmental public health expert, so you kind of, for me, I still tell people I don't know what I want to be when I grow up, but I know it's within this field. And I know my why. Like, I want to help people improve their quality of life, but I can see myself doing a lot of different things throughout my life. So to that question, I would say stick with what you're interested in. If you're interested in a class that pops up, take it. Obviously, you have to get your requirements of classes through, but I think doors will open because you're pursuing something that you're truly passionate about and interested in. I hope that answered your question.
And also, if I can jump in, it's only a 2-year program, and so you only have so many electives and so many classes you can take. But one thing that you can really do to explore is within each class, like you have there's typically a lot of flexibility with like topics and what you want to research and just all of those things. So use those opportunities to just explore different avenues. For me, I came in really wanting to work with refugee communities, and I still do. And it was a really good opportunity to in like policy classes to look at policies affecting refugees in the US or yeah, so just being able to fit it into the classes that I'm already taking.
Anna, did you?
Yeah, just to tag on a little bit, I would encourage you to even look at electives outside of MESCOF, because one of the things that I've learned since graduating is truly how intersectional public health is. I mean, the fact that Lindsay works at Glendale Community College, right? I mean, public health is everywhere, especially right now in the pandemic, you know? Like, I'm so glad that we have a public health person in academia because you can hopefully inform the decisions that they're making about bringing students back and stuff like that. So I took a couple electives outside of MESCOF, and I think it was really eye-opening to see how other people view public health, and also to show you how you can insert public health in other topics as well.
Here's a question from Giselle. Is that how we say your name, Giselle?
Well, yeah, my name is Giselle. I had a question. Can you hear me?
Now we can.
Okay, sorry about that. Yeah, my name is Giselle. I had a question about pursuing a PhD in public health. And if you all have any tips or how we can start preparing for PhDs. Yeah, thank you.
You know, none of them have PhD, none of them have doctorates. So I would be curious what they would say, but you know, from a perspective of somebody who's been in my position a very long time, what you really want to do is get to know the faculty, get to know the research areas, and there's no better place than a college to be looking at all the research that goes on right now. You know, everything, not everything, but it seems like every research project that's coming up right now has to do with COVID, but there's a lot more things going on than that. But even within it, there's some really interesting things. Let me just tell you about one thing though, and I thought like, wow, now that's really cool. You know how there's the testing and the treating and tracing and all that. Well, very early on, after we knew there was this coronavirus out there, Kelly Reynolds, who's the department head of community environment and policy, came to one of our COVID meetings and said, hey, you know, we're doing a wastewater project that you can find COVID in the wastewater. And so what that means is that, and then I started hearing it talked about even more, but even on our campus, what's going on is, you know, yes, they're testing students in dorms and everything, but they've picked out random buildings within the campus to test the wastewater in there so that they'll be able to figure out if there are people within that building who have it. So, you know, who would think, okay, yeah, let's look at the sewage, okay. But indeed, it does show something, and they're always looking for different ways to apply what they work on. Like Kelly Reynolds works on water sanitation issues all the time and clean water. So obviously, she would be interested in something like that. But as far as doctoral programs go, you really just want to start learning about the faculty that work here. Do well in your classes, because especially your math and science type classes, et cetera, because that's what is looked at when you're reviewed or for admission. Okay, I'm going to ask a question that every year comes up, but I haven't heard it yet, so I'm just going to put it out there. What subject within your curriculum do you wish you'd learn more about? And
Biostats.
biostats. And um, and what I mean by that is what do you need to use in your current position that you wish you had? And so Alex says biostats. What would you have done differently then? How many classes did you take of it?
2 biostats classes and 1 epidemiology class. You know, as a policy and management person, we took a lot of policy stuff, but there's just biostats everywhere, and learning how to use the software. And I mean, in the clinical world now, learning how to like interpret, you know, journal articles and p-values and stuff. I still can't say I fully get it. So yeah, it's definitely something that's good.
Anybody else want to answer
I
that?
think for me, it's funny since Alex said he studied management and policy, because I would actually say I wish I took more management and policy classes. I'm not working at all like quantitatively, so I'm happy with the level of biostats that I received. But I do work more so in management now, so I wish I would have maybe taken some classes, and especially with, I don't know, I think policy touches upon all of our work. We're all impacted by policy in one way or another in public health. So I wish I would have taken a little bit more classes in that area as well.
I would say, I think if you're interested in program management of some kind, evaluation is really important. I mean, probably in any sort of programming. So that would be my recommendation, because I did take a qualitative evaluation class and I loved it, but I wish I would have taken more on that subject.
I would echo the policy and management courses. I'm a policy director, and I basically had to learn on the fly. I think I took 1 policy management course in my MPH. So there's that course. And then also there was a course, I don't know if they saw it, but it's like sociocultural aspects of health, which I really enjoyed. And the mindset that creates for you, I think, is something that I use in meetings constantly. Like anytime that I'm in a meeting with policymakers or big muckety mucks and they're talking about big P policy decisions, I'm constantly thinking about, well, what does this mean culturally for specific populations that in the current policy systems just aren't thriving? And so I think I could have honed that skill earlier on.
I would echo what Lindsay said. As a program director, I'm having to learn on the fly a little bit more about monitoring and evaluation. And I wish I would have, there's just not enough time in the 2 years. I wish I would have taken more electives and more classes, but specifically in M&E for sure.
You know, that's a really good observation. I mean, that 2 years goes by just like that. And sometimes you're sitting there thinking, okay, well, I'll wait till the end of the year and think about more what I want to do. But then the next year comes along and you've got to do that internship, et cetera. So you really, I'm encouraging you to start thinking broadly about the different things that go on in public health. One of the questions I have of you guys, though, is this degree is called a Master of Public Health. And from my experience with it, people believe that they believe all kinds of things about public health, and sometimes those folks out in the world who are hiring people actually, if you are applying for a job with a Master of Public Health, they often think that you are a biostatistician, you are an epidemiologist, you are this or you're that. Did you guys ever have you encountered that at all? Okay. I only bring it up because the degree is extremely versatile, and it really because there are 5 core areas of the degree 5 core courses that you have to take, and all these different concentration areas, you could be completely different than the next person. Believe think about the person who's in a mine, an Arizona mine, who's looking at the safety of mining equipment or the practices in mines, and then you look at the person who's working for the refugee agency, in a big city or something, and how different their jobs are. Well, the same degree prepared them for those positions. Okay, guys, I know, here, there's another question that always comes up, but I don't hear it yet. I bet you could think of what it is.
Do you make any money?
Well, there's that, yeah. Okay, that's a good one.
That's what I was most curious about.
Were you at the time? Yeah. Obviously, there are areas within public health that make more money than others. And if that's really important to you, start doing some more digging about those things. No, the question is, what's the one thing you would have done differently if you had it to do it over again?
Something that popped into my head that is not necessarily academic related, but more mental health related. I wish I would have taken better care of my mental health, because it can be a lot. It could be high pressure. I don't know what you've been doing previously, but I came from the Peace Corps into a graduate program, and it was a lot. And so I think just knowing that it's going to be hard, but you can do hard things, and setting up some positive coping mechanisms is what I would share with you all.
I think to add on to that, maybe along the same lines is, I guess, I don't know, is everyone doing this virtually? I guess eventually when you get to Tucson, if you're new to Tucson, it's such a beautiful area, the Southwest in general. And I was able to see, I'm from Pennsylvania originally, so I was brand new to the region and had never visited before. And I was able to see a little bit, but looking back, I wish I would have explored more of the area and just take advantage of being in the area. I did a couple service learning courses, so that was really helpful to experience different parts of the area, but also just on the weekends, get out and explore when you can, and it's safe. And it's safe.
I'm sure you'll be coming back when you're finished with Mozambique.
Definitely. I come back. I come back to Tucson every 2 years. I've had a good streak going, so.
I think for me, if I were to do something differently, I think I would have put less pressure on myself to this sounds cliche now, but to know what I wanted to do afterwards. I entered the program kind of just wanting to see what public health was and just get a feel for all the aspects of it, and just a pretty open mind. Just wanted to explore everything. And then coming out of it, it's only 2 years. So I really wanted I had some ideas of the kinds of jobs I wanted to get, and nothing was really coming my way. I took that job in the transplant department as kind of a fail-safe. And it turned out to be great, because then I was able to move over to the HIV clinic, and then went into clinical care. And I think if I could do it over, I think I would have just been more open to options, and not committing myself to one specific direction, but just, as you said, Chris, realizing this degree can do a lot of different things. And a lot of what you're going to do is learn how to pick up those skills when you get there. So,
yeah. Alex, I really like that answer. I mean, I'm somebody who I went into public health school for the first time in my academic career. I was like, I don't know exactly what I want to do with this, but I'm really passionate about this subject and I want to learn. And as I went through those 2 years, I mean, jobs that were available at the end of those 2 years, some of them have been in place 2 years prior. So like based on a lot of things that have happened in the healthcare sector, there's in positions like population health officer, which 5 years ago, 10 years ago, that didn't exist, but there's more of a focus on public health type strategies within healthcare that they're now creating new types of jobs where they're looking for a public health skill set. And I think that you need to kind of go into it thinking that maybe there's an area that you're passionate about, but that specific job, maybe it exists right now, maybe it doesn't, but you'll be able to apply these learnings to it.
For me, I wish I hadn't come in with this preconceived notion of which area I didn't want to work in. I kind of identified with what Marcus said in the beginning. I was like, oh no, never policy, no. And now I really wish I would have given it more of a chance, because I'm trying to get more involved in policy and advocacy in my current position, and I'm having to learn on my own again and take, certifications outside of it. But it would have been nice to kind of get more of a sense for public health policy during the program.
Chris, you're muted.
There's going to be somebody who can read lips one of these days. I was going to say, Tanya and Kim, you're both alums of the program, and anything you want to add at this point? And you've also seen many of these guys go through. Words of wisdom.
I do. I have some words of wisdom. So I'm an alum from a little bit prior to these folks. It seems like this crew is like the 13 to 14 crew, and way back when in 2008. I think that's right. That's right. And so I think that I love everything that has been said today. Keep an open mind, get those experiences, even if it's just one or two things you choose. 2 years goes fast. They're all the same things I tell students when they first come into the door. So I think it's perfect. I also think you have to really embrace that it's okay to fail a little bit. I don't mean fail your classes. That's not what I mean. I mean, it's okay to try things and not like them. So I am the classic person. I did an internship, not what I wanted to do. I did an independent study, not what I wanted to do. But I'm so glad I tried those things in school and not as a first-time job, because I wouldn't have been happy. And so it's okay to try new things. You can volunteer, you can look at independent studies, you can do internships, both you have to in the program, outside of that. So really embrace, especially those of you who are coming in with the, I know I like this, but I don't know what it's gonna mean. Embrace that a little bit, try as much as you can. You don't have to finish the program in 2 years. So 2 years is great. I know you're thinking about cost and time. Being a part-time student is not a bad thing if that's what works for you. Taking more than you have to is okay too. So if you want that extra biostats class and you need to take 45 units instead of 42, that's okay. So just remember that this is your degree, not anybody else's. So do what you need to do to make it work for you, taking advice from lots of people, but remembering that your path is going to be different than everybody else's, and that's okay. That's a good thing.
Thank you.
Actually really echo that, because it's very funny that Lindsay is on our panel today. Oftentimes when I talk to students about taking elective courses, I use me and Lindsay as an example of being in the same cohort, in the same concentration, and vastly different interests. So when we talk about selecting electives, I took second semester biostat. Lindsay took a gardening class because she was interested in built environment, and it made sense for her, but that would not have made sense for me. But we were in the same concentration. We were taking the same core courses. So I wanted to shout that out, Lindsay, because I have used that for many years talking to students, about how your paths, yes, you're getting the same degree, even within the same concentration, but there is a way to have that same focus-ish, but be able to kind of really make it your own. I will say my interest is in human sexuality, and we don't have a concentration in sexual health, but I chose most of the, projects where I could choose my own topic or do my own research. I chose to make that my own. So there are definitely areas where even if you are in a specific concentration, but you have multiple interests, you can find other ways to really build those skills, build that knowledge, do your internship where it crosses multiple concentrations or topic areas. So there's just a lot of ways to kind of sneak in other content without taking a ton of extra classes.
Now we've got some questions. I know that Carrie's got her hand up and there's a couple here.
Yeah, thanks, Chris. This is Carrie. Thanks, everyone. It's great to kind of meet some students and alumni. So I work in workforce development right now in Tucson. I've been here about 6 years, and I'll be in the MPH HBHP program. So what I am thinking of is kind of tagging off of what a lot of you have said around employability and marketability of your skills. The comment of Dean Tish about, being thought that your master's, your degree means one thing or another to certain employers. So coming back to Lindsay, one of your comments was finding that you weren't exactly sure what field you wanted to go into within, after graduating, and how marketable can the HBHB masters really bring for job opportunities, in after graduation. And could be 2 years from now. I'm a part-time student, so it will be several years in the future. Landscape might be very different than with COVID changes, but just kind of coming back to how broad that field is, and yeah, what you guys think on marketability and employability.
Sure. And I mean, Alex and Tanya, feel free to jump in too. I would say, Kelly, that doors are going to open. There's so many opportunities within the field. The thing that's a little bit trickier with HBHP is that you really have to look. So, when you do your job search, you're not going to be able to just do health, behavior, health promotion. You're going to have to think about what you actually want to go into, and you're going to have to search organizations. You're going to have to look up job titles, but they're out there. Just as my resume shows, there's a lot that you can do with your degree. But yeah, I think just having an MPH behind your name, people they're gonna be interested in what you have to say and share with them.
I can't say that this actually worked for me, but one of my strategies in the program was, I think in the last year of the program, in year 2, I think I went to APHA at one of the conferences, and I just found a bunch of organizations that I was like, oh, that'd be cool to do. And so I went on their websites, found job descriptions, for even senior level stuff I would have been able to do. But just found 5 or 6 specific job descriptions, all with different titles, either analyst or project coordinator or whatever. And my degree would be applicable to any of those things. But really it's just taking the qualifications or the job description and then being able to say oh, I can do that. Oh, I can't do that. I can do that. And so just it gives you a little bit of a target as far as employability is concerned, knowing what an organization is looking for in a specific type of position. So.
There's a question here from Haley Ann. What kind of time management skills did you all use being in your program? And also, were you able to have part-time jobs or non-related to the program? And then the other question related to that is if you experienced having full-time jobs in while you were working on the degree.
Yeah, so throughout my program, I was working and going to school at the same time. And so I would go into work. I was actually working as an intern at a local advocacy organization in Phoenix. And I was also part-time managing a fitness center in downtown Phoenix, and then taking online, most of the classes were online, and some were in person. So it definitely forced me to think about time management. The days The days were long. I remember looking at my friends who were working professionally, and they would get off work at 5 p.m. And I was like, oh my gosh, I can't believe you get done with your day basically at 5 p.m. and it's still daylight outside. So it's doable. It's tough sometimes. You make it work, and you learn skill sets that definitely help you in your career later on in life, because you do learn time management. I mean, I took biostatistics online, and I remember like the first day of classes, there's no way I'm going to be able to do this. But at the end, I ended up doing well in the class, and I was pretty proud of it because I taught myself how to do this stuff, and I learned how to manage my time better. So for those of you who are thinking about working and going to school, it is doable. It's not always easy, but it's doable.
I could echo to what Marcus said. So there's a Peace Corps Fellows program on campus, but it did require that you find a part-time internship. So it was paid internship, fed me into my first job post MESCOF. And so I would say, yeah, it's possible. You do have to really kind of turn up those time management skills and make time to eat, make time to, take care of yourself. But you're definitely going to be busy. And what else was I going to say? I mean, like some of those opportunities to work may end up being your job afterwards. So it's definitely possible.
I was going to add on, I actually went to this like managing stress, time management session somewhere at U of A hosted it right when I started grad school. And there was something that the speaker said that I still use in my current job today. And she basically said, take a period of time, let's say it's a morning, or if you want to say a day, and you're going to have a long to-do list for your classes. If you're working, there's going to be always a lot of things that you're going to have to do, a lot of things on your list, and just prioritize 3 things that you want to accomplish. If you're looking at like a morning before class, you're like, okay, I want to try to accomplish these 3 things. And it just kind of helps narrow it down and not seem so stressful when you look at a list of like 15 different things you have to do. And so I actually do that still today. At the end of the day, I take my to-do list and I look at my list and take 3 things and I say, this is what I want to accomplish tomorrow. And that's how I start my day, is looking at those 3 things and trying to accomplish them.
So you can still have your 25 things, but you take 3 things off of there and put it at the top. Okay. Exactly. Thanks. I think I might have brought it up in the other session about when we were talking about LinkedIn, but you will start realizing that there are some skills within public health that are big, they are high priority skills. And you already heard these guys talk about evaluation, analysis, stuff like that. You want to get those words on the resume, and or if you don't have those skills, make sure that you get yourself in a class or a project where you can learn how. And there's qualitative evaluation, quantitative evaluation, but those kinds of skills are really, really highly prized. Okay, so now guys and alums, think about, okay, so these guys are starting down the road for what basically is a 2-year program, but I wanted to also emphasize, can anybody tell us the answer to this question? How long do you have to work on this program, on this degree, and still be within the graduate college rules? Does anybody know? Yeah, you guys know. Okay. All right, Tanya, go ahead, tell them.
Chat is right. 6 years. So even though our program is just for full-time students to complete in 2 years, master's students have 6 years from the first class that you're applying to that degree program. So, yeah.
It's a rarity. It's a rarity that it happens that way, but sometimes if it does, that's just the way it is. Don't stop. You have to stop out. That's different, but you come back. Okay, so you guys are looking at these newbies here, and what's the, is there anything that you haven't said already that you really want an idea to impart to them?
That's one thing I thought, kind of back to Riley's question about decisions. And I think I told you this, Chris. Back when I was actually deciding on which grad school to go to, I was trying to decide between Emory and Mezcoff. And I ultimately decided on Mezcoff because it was just financially better for me. But my goal before I started grad school was to work at CDC. And the draw of Emory is that CDC is in Emory's backyard. They literally share a property together. And so at CDC, there are a lot of Emory grads. Like it seems like everyone went to Emory. And so I was a little nervous coming into Mezcoff and, if I would be able to reach that career goal. And I did. And I think I was able to because you really have to make your MPH program. It's really up to you to shape it and make it what you want out of it. And so having a goal like that in mind, you can still kind of take classes and have experiences and get involved in a way that can still, get you to the goal that you want after grad school. So just wanted to kind of share that. Yeah, you'll have a lot of doors that will open after you're done with the program.
I want to echo a little bit about what you just said, Rachel, and kind of tying it into internship. We haven't talked a lot about internship opportunities and that today. And I really would say to you guys to not be afraid to put yourself out there in front of organizations, employers that aren't actively searching for interns. You never know who might open the door to you if you just say like, hey, I have these skills and I'm willing and able to do anything that you have that's tied to that. I know that that's kind of what I did for my internship. There wasn't anything out there that I saw that really fit what I wanted to do. So I just crafted my own and I found an organization that was willing to let me do it. And now in my current position, there have been multiple times that students have reached out to me saying like, hey, I have a ton of enthusiasm and I have these skills. Is there anything that I can do for you? And we always find a spot for them. And actually we've hired a couple of them and I wasn't actively looking for help. So don't be afraid to look up organizations. And if you really identify with what they're doing, just put yourself in front of them and say like, hey, this is what I'm here for. And you never know, maybe after graduation, they'll remember seeing your resume and your name.
And your smiling face.
Yeah, tagging on to what Anna said, words of wisdom. I mean, I'm from Tucson, so maybe I'm biased, but I think most people would agree that like Tucson's really incredible in its sense of community and like the connections that the U of A and the College of Public Health has with organizations in Tucson. Like everybody knows the U of A. So many, it's like Tucson is littered with Mezcoff graduates. And I know, I mean, it's just a great place to like make your own job, or if you're willing to work for free, you can do that too. But yeah, like I was interested in refugee stuff and I knew some people that worked at the resettlement agencies and was able to do AmeriCorps through a refugee agency that actually Rachel ended up doing too, while I was at Mezcoff. And I was able to kind of combine all three things together in some like classwork and some of the projects I did for the IRC, for the organization. So yeah, Tucson's a really well-connected community, and just really dig in.
Yeah, I was gonna say yes to opportunities that come your way, even if they seem intimidating first. I remember that when I started school, I had the opportunity to kind of get into a big room with a whole bunch of people or professionals in my mind, and I was just kind of shocked that I was even in this meeting. And that was the springboard to me actually first job. Yes, I had the comment MPH next to my name, but it was also a facial recognition of, oh, Marcus, you were in that meeting with us a couple months ago talking about blah, 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 blah. And so it reaffirmed that I was capable, but also just a person who was out there, who was interested in this stuff, and that someone had interacted with before. So it's pretty common to talk about. It's all about who you know, but sometimes it really does help. So the more yourself in certain circles, even if you feel like these people know way more than I do, sometimes it might be the case, but often it's not, and you have to contribute. And so say yes to those opportunities.
I guess I'm last. Mine is more, I guess, on that self-care side. The reason why I'm saying this is because I'm currently listening to an audiobook called Breath by James Nestor, but I would just say, remember to breathe. A lot of you right now are probably holding your breath because you're nervous and you're just not sure if you're going to make it or hack it. But I think we're all evidence that you're going to work your butts off. You're going to make it through. There's great things at the end, and just breathe. Your health is important too. So that's my advice.
Very good advice. Betsy has a question about the rural health. What is the PP part of it? AHEC Scholars Program. Were there any of these? I think it started after they were done, Betsy.
Sorry, I was in the middle of typing a response out, but I'll just say, the program, this specific program, we had service learning classes, but in terms of like packaging it and being funded as a specific program through the AHEC, that was more recent. And so I don't think that our panelists would be able to speak to that. But if you want to send me an email, I can connect you with the director of the program, and he could probably give you some more information about what that program is like.
That's Dr. Verhoogstreet. That I think, Betsy, I told you that, but I don't know. There's 2 new messages. Okay, what? Passport code is 5. Ooh, what was the best resource best resource or tool that you utilized during your 2-year program?
Google Docs?
Google Docs? Yeah, we used that a lot, didn't we?
I
Actually,
guess
if I could
something, oh, sorry. I don't know how much I used it during my grad school, but something that I use all the time now is Excel. I don't know about other people in their jobs, but my organization relies on Excel for what seems like a lot of things. And so if you do have the opportunity to like really harness your Excel skills, I think that's really helpful.
Anybody else?
The med school library, I practically lived there, and I would encourage you guys to get familiar with it. Cafeteria has pretty okay food too, so.
Yeah, of course, the library has different rules right now during COVID, and it seems to change every day, so we will always be publishing whatever policy du jour there is regarding the libraries. What?
Sorry, I was going to say, I know that these tools weren't really needed back when I was in school, but these online learning platforms, I think, are going to be of real interest in your schooling and in future careers. So whether it's like understanding Zoom and being able to break people up into breakout rooms, or using things like IdeaPad, which is like an online way to do like to move sticky notes around and collective thought. There's a ton of other, Microsoft Teams, any of those tech type platforms that help us communicate. I think this is going to be sticking around for a while, even after COVID. And it'll help to set yourself apart for when you're interviewing with somebody who's maybe not as familiar with this stuff, and they'll say, oh, wow, we could definitely use that skill set too.
The one thing about all the children in elementary school right now is I think that, you know, they're all learning so much about online platforms that you know, none of us knew until we were required to use it for something. Here's one, Slack for group projects. What is that?
It's like Microsoft Teams, but you don't have to have the Microsoft program to do it.
Pretty funny. We're slacking. And Rachel, this is a personal question that I had, not a personal question, but working at the CDC, okay, with all the recent, you know, noise around the CDC and everything, is it, you know, still a great place to work? And do people have they acted as if, to you or anybody else that you know of who works there, as if it's just not what it should be?
Good question. I haven't really experienced that per se. And to give a little context, like anytime there is a huge outbreak, usually it's an epidemic and not a pandemic, or any type of emergency response, we activate our emergency operations center. And usually there's an opportunity, even if you work in a different part of CDC, to volunteer and work in that emergency operations center. So I actually worked on the COVID response back in February, back when we didn't have any known cases in the US, which seems like a lifetime ago now. And I actually was part of the response, responding to the Diamond Princess cruise. And that was the cruise off the coast of Japan that had the most number of COVID cases outside of mainland China back in the beginning of the pandemic. So yeah, it was I hadn't had any experience with like kind of emergency response work. And I really learned a lot in that experience. And I found the work to be really, really gratifying. And I think people still do who are working on the response now, but you know, it is different. It is difficult being in this political environment, and public health is being politicized more now than ever. And so I think that kind of goes back to my comment about understanding policy, because it really does impact all of our work.
Thank you. That's good to hear, I guess. Rachel started with there, and you will see these advertisements and opportunities promoted whenever we know of fellowships or internships that you could do for your internship or even after you're done with your degree program. But Rachel's was a joint project between, it's called ASPPH, which stands for the Association of Schools and Programs of Public Health, yeah, and the CDC. So, and there are other students, other alums who are there still, or who have gone there and have since left there. So I would say that we probably, our students compete well for these positions. And so it was not necessary to be at Emory. I will say that. She got there anyway. So that's, you know, says something. So when, you know, you're sick and tired of hearing every email that we can ever send, you never know when it's the one thing that's like, oh my gosh, this is the position that has my name on it. Or this is the agency that I really want to get to know more. Just check it out. And you know, even though we're all still in our homes, etc., one of these days we're gonna see each other in real time and get to know each other. And I can't wait for that day. But if I think we are, you know, at our close here, if there's anything else, please know that on the bios that I sent over to everybody, our folks' contact info is on there. But Marcus, what's yours?
I'll go ahead and put it in the chat, and then
Thank you.
Have it too, so you can include it.
But I cannot thank you guys enough. It's just, you know, it's been a really long 6 months for all of us, 5, 6 months. And to see our new students with those of you who have gone on to wonderful things, it just makes my heart, you know, happy with joy. I'm sure Kim's, Tanya's, Gisella's, same thing. We just, you know, we want you to embrace this degree program as much as these guys have, and hope that their information that they have shared will help you along the way. Gisela, can you tell us what time that we need to gather tomorrow? Because she's not.
I've seen this time so many times, but just to be sure, let me open the I don't want to say the wrong time.
Did you say it, or you're looking?
I'm looking.
Okay.
So
the other thing, go ahead.
Sorry. So we will be starting with Dean Imam Hakim's welcome promptly at 8:15 a.m. If you want to connect earlier, and make sure all your Zoom is working because attendance will be taken throughout the day.
Okay, thank you, Gisela. Go out and do good work still, guys. I mean, continue to do good work. And please don't be strangers. You know, keep yourselves involved with the college. I forgot to mention to you all that this is the 20th year of the college, and we had intended to have a big gala event, and that won't be occurring. Instead, there will be 20 days for 20 years or something. We'll be celebrating people and things that occurred in the college, and that will be, I believe, in November. So stay tuned for that, and everybody, you know, keep on keeping on.
Go and fill out your census.
Pardon me?
Go vote and fill out your census.
Yep. I will just tell you, I just got a text from somewhere that was wanting me to go. It said, ask for your ballot here. And I'm like, this is not what this is something that is a scam. And they're already at it. So let's do our part for our country and for public health. Okay, so thank you everyone, and we'll see our new guys tomorrow morning, and our alums. I was going to say our old guys, but none of you guys are old, so you're older than you were. But thank you very, very much for being part of this. It's been a great deal of fun.
Dean, Tish, sorry to interrupt, but it was asked a couple times in the chat, and I think it was just skipped over, but is there a passport code for today's session?
And I did. I was in the chat at the beginning, and it's 5. Remember, we had 5 alums, so this was 5.
5, awesome. Thank
All
you,
right.
sorry to miss that.
All right, bye-bye.
Bye. Thanks.